Hi, everybody. I'm Tina Shih, and I'm on a computer in a clinic room, so it turned out it was logged into one of my colleagues. I'm going to share just one slide, and I really want to leave the discussion more to what people want to talk about. I threw out this topic because I spend a lot of time when I'm talking with patients. I end up talking about a lot of non-seizure related issues in epilepsy, and a lot of them are social work related. And I think it's really important in terms of how we consider living with the condition. And so I thought it wouldn't be a bad idea to potentially talk a little bit about different topics, but I really want to leave it open because individuals in a group could have very, very different knowledge bases, and some of this may be review or very not interesting to you. So I'm prepared to sort of just talk off the cuff about any of these topics. For example, a lot of my patients who are adult patients don't know about the regional centers. And I think this is a hugely important resource for our patients, and adults can apply. Many of my adults who end up with epilepsy, but develop epilepsy later in life, they don't know that because they're disabled, that how to apply for Social Security. Or if they're not able to take care of themselves at home because they can't drive and they're having problems with memory, the idea of applying for in-home support services through the county system, getting some educational, vocational training through the Department of Rehab, or individuals who are pursuing higher education or even regular education, the importance of getting an individualized educational plan, or getting neuropsychological testing, or going to your school and asking for accommodations through the Office of Disability. Some people, when they're transitioning to college, will want to talk about a seizure action plan. So really thinking through about living in a dorm room or something like that. And then the other parts that I'm prepared to talk about, if anybody wants to talk about, would be future planning. I think that's really, really important because we're dealing with a condition that is a lifelong condition.
I don't know what you want me to do.
Shannon, did you want to say something? Okay. And so I'm also very much interested in talking with everybody about either, the idea of a special needs trust. I'm not a lawyer, I'm not a person who has a legal background, but some people don't know about these ideas of future planning and thinking about if they had some resources, some funds to be able to set up a special needs trust or the Cal-Able program, which is something new from 2018. So I want to open up to everybody to sort of ask questions, or is there a topic from this list that is interesting to anybody? No. Everybody's muted except for Shannon, so I don't know if anybody's interested or if anybody's even listening.
Okay. Okay. So you have to put me on, you have to call me. Yeah, because I have to know what's going on. Okay. It's up to you. No, I don't want you eating late. Right. Okay. And then ask your daughter if that pizza is the kind she wants, or maybe she wants to change up her pizza type or something. I don't know. Yeah. Yes.
I think that folks are putting their suggestions in the chat section if you want to check it out there. Somebody asked about SSI. If that's helpful.
Tina, I think you're muted.
Hey, Tina, you're on mute. We can't hear you.
Thanks so much. I was just like going on and nobody could hear me. In terms of Social Security, if that was a great question, I'm happy to talk a little bit more about Social Security. So I think one of the best places to start, if you've never applied for Social Security, is to know that you will apply and you will definitely get denied the first time. And most of the barriers to a successful Social Security application actually is getting your medical records. And so that's a really, really hard thing to do. Let me see if I can pull up the SDI, the Social Security website, and share that with you. Give me 2 seconds. Okay. So I'm going to share this. So you want to go to the government website, which is ssa.gov, G-O-V, okay? And if you're applying for disability, you can see on the screen, can everybody see that? You're going to be applying for disability. And what you want to do is you want to click this, apply for disability. Okay, and so it's a pretty arduous process, and I've done this several times with multiple patients. One of the things you want to do is you want to have, if you've worked, you want to have your work history really clearly laid out. Because if you've worked in your life and now you're disabled because of your epilepsy, you do want to make sure you have about 40, you have a number of quarters of previous work experience. I think it's believed to be about 40 quarters of work experience. And so you want to go through the dates of that. And then the other thing you really want to go through is all your medical records, because they'll ask you questions about which hospitals you were admitted to, which doctors you saw, which medications you were taking at different points, what tests were done, like MRIs and EEGs, and they want to know where each of those things were done. And what will happen is you'll submit all this, but the problem is that Social Security will then try to obtain medical records from the places that you list as your hospital. But the problem with that is that oftentimes the different hospitals have very little incentive to send the medical records. And so it gets lost in the mix of things. And oftentimes people are denied, not because they don't have a valid claim, but the real reason is that Social Security never received any kind of data from the hospitals confirming the diagnosis, or any kind of data that the person was actually seen by a physician and that a diagnosis of epilepsy was made. And so a lot of times when I've done this Social Security application with my patients, it takes about 45 minutes to an hour because we have to go through all this kind of stuff. And then at the end, you're able to print off a sheet that says, that has a Social Security office and a release of information. And if you if you have your medical records, you make a copy of those medical records and you put that with that cover sheet and you mail that in together. And the times where I've done that, my patients have been successful without actually getting denied. So that's really important. So a lot of times it's not about actually the claim itself. It's oftentimes the lack of Social Security, of medical records supporting or corroborating your memory of the situation. I also have found that sometimes they question what they call quote unquote objective evidence. So a lot of times they want really good data, either video EEG data that says this is the gold standard and the diagnosis has been confirmed. And so sometimes Social Security will wait for that kind of data. And the other will be sometimes they want to know MRIs and CAT scans and things like that because they consider that objective evidence. Let me see in the chat if there's anything else. Is there another topic that people would like me to talk about? Let me pull up that new share again about the list of topics. And do you have questions based on any of those things about Social Security? Will a social worker help with the application process for Social Security? We don't have that at UCSF, partly because we don't have a full-time social worker. And a lot of social workers, I don't know, I haven't had much success in getting a social worker to do this. But it is really nice because it's so hard to get on the computer and figure this out. And it's the interface between in the application process, it's not that easy. And so I agree with you. I'm wondering if the Epilepsy Foundation ever would, if your local Epilepsy Foundation would be willing to sit with you and help you. So if you could go into their office and you brought all your data with you, your medical records, your job history, if you have W-2 forms or whatever the situation, if that person at the Epilepsy Foundation, they oftentimes do have case managers, whether they'd be willing to sit with you and do the entry into the Social Security website. I think it's a great question to ask your local Epilepsy Foundation. Is there more with future planning regarding employment? That's a great question. Oh, you asked, will the epileptologist help with the application process? It's a great question. I've done it a few times because I have a very, I have a philosophical feeling like, our goal as a physician and an epilepsy specialist is whatever I can do to further my patients' improvement for quality of life. And a lot of my patients, I feel like, if you don't have financial support and you have no way of paying for a lot of things, that probably affects all the other, what we in medicine call the social determinants of health. If you don't have stable housing because you don't have a source of income, and you don't have a source of income that allows you to get good food, and you're stressed out because you don't have a source of income, sometimes I feel like I could try to tell you all these different things that we could do to improve your quality of life with your seizure control, with medicines and with surgery, but that wouldn't be getting to the heart of how to help somebody move forward. So sometimes in those special circumstances where I see somebody's really, really struggling in their condition because that's one of the barriers for improvement, then I will schedule a separate visit to do that. But I think that a lot of people would argue that that's not a really smart use of an MD's time, but I don't know if we all have a choice always in the matter. I think that is a great question. I'm not sure that it's part of an epileptologist's job to do it. And so I wouldn't ask my colleagues to do it. I think it would be voluntary. The second thing in the chat was, is there more with future planning regarding employment? So that's a great question. It really, that's something I do talk with my patients about, because some of my patients, their seizures are reasonably controlled. They have found a good combination of medications, but they have other parts of their epilepsy that are impacting their ability to work. For example, they have cognitive issues such as memory problems, or their processing speed is slower because of their medications or because of the epilepsy itself. And so we do talk about, is employment a possibility in terms of that situation? And so one of the questions I always ask my patients are you having seizures where you would have to call in sick to work more than 4 days a month? If that's the case, it would be hard for an employer to hire you or for you to sustain employment. And so that's one of the basis for actually disability. You know, if you're having some kind of medical issue that may not be every day, but is making you call in sick to work more than 4 days a month. And that could be a single seizure. So some of my patients have a really, really bad seizure, and then their post-seizure recovery is 3 or 4 days. Then they end up, if they have an average of 1 bad seizure a month or 1 or 2 bad seizures, you know, every 2 months, that would push them over the edge where an employer might not hold on to keeping them as an employee. I think that's a really reasonable reason to apply for disability at that point. But if the seizures are controlled enough that a person feels like they can go back to employment, then we start talking about how do we do that process of trying to either get the vocational training to get us up to speed. So if you're on Social Security disability and you are improving in your medical condition, then you go to the Department of Rehab. So DOR is a federally funded, and it has local chapters or local offices all throughout the state of California. And you would go to your local DOR and you would apply and see if you had an area of training you wanted to get, or go back and get some kind of education or certificate. So the DOR's goal is to help people who are disabled go back to the workforce. And so that's their job. And so sometimes the DOR will pay for training either at a community college or within their own program themselves, or they have subcontractors who they'll pay for you to do something with them. So that's one possibility, is to go through DOR. Another possibility is, say you're already fully trained and you are very advanced in many ways, and you're really interested in a certain area. I find that government is probably your best bet right now, because the government, either federal government or state government, they actually have programs within the government. Like, for example, Social Security, they are supposed to want to hire people with disabilities. And so they have specific programs for people to apply where they have to demonstrate that they actually have a disability. So I've written letters of support for some of my patients stating that they have a disability that is pervasive enough that it meets the criteria for the ADA, for Americans with Disabilities Act. And then they would qualify to apply for this special program that gets special consideration within the federal government or within the state government. So that's something that I oftentimes encourage my patients to look at. I have one patient who actually he was very, very persistent, and he was able to get a job in Social Security, actually, in SSA, and it's a very, very good job. And he's actually doing really, really well there now. It took a lot of time, and he qualified for sure, but he hit a lot of sort of brick walls or closed doors, but he was very persistent. He didn't give up. And eventually, after about 6 months to a year, and he also has a father who is also a very, very great advocate, they were able to navigate this very complicated program, and they were able to find him a really good job within that organization. Let me see within chats. Is there anything else anybody's specifically interested in? Does everybody know about in-home support services too? You know, it is really hard without social work support to know what services are available. And, you know, you're hitting the nail on the head. You know, one of the things, I'm a person who trains epileptologists, so I'm a fellowship director at UCSF. And within the field of epilepsy, it actually is considered an important pillar of education that we teach the epileptologists more about what we call the social determinants of health, because epilepsy is a chronic condition that's quite dynamic. It's affects people across the entire lifespan. And so it is really, really important to think about all the other non-medical aspects of the condition and to be aware of what's available for our patients. So these are things I try to stress with many of my trainees. So sometimes I'll see patients in the clinic with them and I'll be like, oh, is this patient a client of the regional center? And the family, the patient may be quite disabled, may have intellectual disability, mild intellectual disability, or have autistic features, but is high functioning enough that they were never referred to the regional center because they were considered too high functioning. But with the diagnosis of epilepsy plus certain kind of comorbidities, the regional center would consider that individual. And they've also changed some of the criteria for application for the regional center. Autism spectrum wasn't considered a diagnosis that they would consider, but the last 10, 15 years, they've been much more open to taking on people without intellectual disability, but having autistic features and epilepsy, for example. So it is really, really challenging. You're right. And many epilepsy centers, there aren't social workers who are trained in the field of epilepsy to know all the different resources. But I was told, at least in Northern California, that the Epilepsy Foundation of Northern California is very interested in this side of things. They have a case manager who is more aware. I don't know the Epilepsy Foundation in LA and the Southern California ones, but they may have resources. So the Epilepsy Foundation may be a good place to start. And then, of course, the epilepsy centers themselves, there may be other epilepsy centers who do have more social work help. I know the pediatric services oftentimes have great social workers. And so I've sometimes sort of gone there and asked for help, but they're very specific to the pediatric world. And so the adult world, oftentimes I feel we would do better if we had people who are trained. Oh, great. Yeah. So Epilepsy Foundation support of North Orange County may be one. So how does one qualify for in-home support services? So it requires that you have a condition that affects one of your activities of daily living. So it's not the foundation. It's another organization. Thank you, Rachel. Epilepsy Support Network in Orange County. Okay, I'm not aware of that. And thank you for letting the other people in the group know that they may be actually a great resource. Great. Thank you so much. So IHSS, there's a few questions that a physician has to answer. So one, we have to answer if the person has a disability that's affecting a major life area. So it could be that your seizures are preventing you from showering and in a way that is safe, or you can't drive to get yourself groceries, and there's no public transportation, and your seizures are such that you couldn't take public transportation. Or you have memory problems, and so it's really hard for you to navigate public transportation. So those are all situations where you might qualify for in-home support services. So in-home support services is county-based. And the idea behind it also is that your income is low enough that you couldn't afford it. So you have to have a low enough income, and you have to have an area of major life activity of daily living, either what we call an instrumental activity of daily living or just a routine activity of daily living that you need help with. So it could be laundry and or food preparation because your seizures prevent you from making yourself hot food or something like that. Then in those situations, I have applied with my patients for in-home support services. And so it requires us to fill out something called a medical physician certification form. And then you go to IHSS in the county, and it's usually in a Social Security office in the county, and you apply. The problem with in-home support services is finding a qualified caregiver. Right now, given how bad employment, how many people out there who are jobs that are unfilled. A lot of IHSS, a lot of people who are caregiving have left the field. And so it's very hard to find a qualified caregiver. But it could be that you have a family member who's doing those things right now and isn't getting paid for it, like a cousin or an aunt or a sister or a sibling. They could then apply to be an in-home supportive services provider. So they have to prove that they don't have a felony, and they get fingerprinted, and then they would then apply to be an IHSS provider. And it may be that they're only getting paid like 10 hours a week or 4 hours a week, but it's something that they're getting reimbursed for something that they're already doing. So that's something that is really worthwhile looking into with this condition. Any other questions that I could answer?